Right now in the nation's capital, activists fighting Medicaid cuts are holding a 60-hour vigil on the National Mall as millions brace for the impact of President Trump's big, beautiful bill. It will slash nearly $1 trillion from Medicaid over the next 10 years. The White House says people with disabilities won't be affected by these cuts, but many are concerned their care will be limited. About 4.5 million disabled Americans rely on Medicaid for home services that would otherwise be too expensive. And one of those people is June Rice, a 10-year-old girl who needs around-the-clock care to manage rare diseases that affect her intestines and brain. And joining us now is June's mom, Courtney Demmett Rice. Courtney, thank you so much for taking the time to talk with us. Tell us more about your daughter's condition. How has Medicaid helped her and your family?
Yeah, so June has a rare disease that affects almost every organ system in her body, so it's pretty extensive. But Medicaid has been life-saving for her. There's been so many times that we've had to take her to the emergency room for things like life-threatening infections. And I can't imagine if we didn't have Medicaid and we had to think every time we took her to the hospital or she had a surgery about how much it was going to cost, would we put that care off to be able to afford it and then maybe be waiting until it's too late? So it genuinely is a lifesaver, truly.
And we mentioned the home services piece of this. Can you tell us more about the types of services you receive through Medicaid that wouldn't otherwise be possible, and what happened if you lost access?
Sure. So one of the most important parts of the home care that we access is having nursing in our home, so an in-home service. If we didn't have nursing in our home and we weren't able to care for June would have to be institutionalized. But these home care services are a lot cheaper for states to run than 24/7, institutionalization and nursing care for people. It's a lot cheaper for us to access nursing for maybe 30 or 40 hours a week instead of the state caring for her 24/7. But so the nurses come, they help change her ileostomy bag, they do tube feedings, administer medications, just all sorts of care.
We see these great pictures of her. She looks like a joyful girl, that's for sure. You can tell she's loved and loves you and the family. The White House has said the Medicaid changes will not impact home and community-based care. Do you feel confident in that?
Absolutely not. So home and community-based services are typically optional by state. So that means that there's no mandate that requires states to have these types of programs. So as states kind of start to balance their budgets, we don't know where that money is going to come out of. So these optional programs, they may be discontinued. They may have enrollment limited. They may say, hey, we'll pay for these things, but we're not going to pay for nursing services anymore. We really don't know. It's going to be state by state. It's very uncertain. And I think that's one of the hardest parts is that with our daughter's condition, there's already so much uncertainty surrounding her health and prognosis. And then now we have to deal with this uncertainty on top of it. And Medicaid should be a safety net. We should feel safe because we have Medicaid and now we don't.
As you hear lawmakers on the Hill or had, heard their discussions around these potential cuts when they were debating this big, beautiful bill, as it's been coined by the president, what was going through your mind? What kinds of conversations were happening amongst you and your friends and family?
A lot of us were calling our Senate offices, both the Utah offices and the DC offices, trying to leave messages and talk to staffers to express our concerns. Our nurse went and met with some of our senators in DC. So we were not met with a lot of consideration or respect by those officials. They didn't seem to listen to what we had to say. I think that we're very heavily embedded in the healthcare system and the healthcare economy, and they are not. I don't think they really understand how it works, or they just don't care. But some of the other conversations we were having is, if we lose nursing care, do I have to leave my job? I do biomedical research. I'm working on a PhD in neurobiology, and I study the diseases that are like the ones that affect June, and I'm trying to help find cures and treatments for those diseases. And so if we lose nursing care, I can't do that anymore. I will have to stay home full time, and that will keep me contributing to the community, in that way. So Medicaid is a tool that allows us to work. And so if we lose these services, I won't be able to work.
Well, Courtney Demmett Rice, thank you so much for helping us understand the real life impacts on families like yours, on children like June, because of these cuts. We just really appreciate your time. Thanks so much for sharing some of your family with us.
Thank you.